Before we do anything else today, let's do a very simple men's health self-check. In the next 30 seconds, you're going to get a quick snapshot of whether the kind of blood in your urine you've had may deserve more attention right now. No panic, no complicated language, no guessing. Just honest answers. If you are over 60, this conversation matters more than many men realize, because a lot of older men think blood in the urine is one simple symptom. Either you have it or you don't. Either it is there or it isn't. But doctors don't think about it that way. They look at type. They look at visibility. They look at whether clots are present. They look at whether the blood was found only under a microscope. And they look at what the bleeding is doing to the rest of the urinary system. I'm Dr. James Whitaker, and here is how this works. You are starting with a perfect score of 7 points. I'm going to describe 7 warning patterns. For each one that applies to you, subtract 1 point. At the end, you'll have a clearer sense of whether your urinary story may be more reassuring, or whether it belongs to a category doctors take more seriously. And stay with me until the end, because the number one mistake men make with blood in the urine is assuming the amount they can see tells the whole story. Let's begin. You start with 7 points. Number 1. Have you ever seen visible blood in your urine, even once? If yes, subtract 1 point. Number 2. Have you ever been told there was blood in your urine on a lab test even though you could not see it yourself? If yes, subtract 1 point. Number 3. Have you ever passed blood clots or had urine that looked thick, dark, or blocked by blood? If yes, subtract 1 point. Number 4. Did the bleeding come with pain, burning, fever, side pain, or back pain? If yes, subtract 1 point. Number 5. Did the bleeding happen without pain, making you feel like it was probably less serious? If yes, subtract 1 point. Number 6. Have you told yourself that microscopic blood probably means nothing because you could not see it? If yes, subtract 1 point. Number 7. Have you assumed that all types of blood in the urine are basically the same thing? If yes, subtract your final point. Now look at your number. If you scored 6 or 7, that is a stronger starting point. You may not be showing many obvious warning patterns right now, and that is good news. If you scored 4 to 5, your body may be sending mixed signals. That does not automatically mean cancer or emergency, but it does mean the pattern deserves attention. If you scored 3 or lower, please do not panic, and please do not shut down. Many older men get confused here because blood in the urine can appear in very different forms. The goal today is not fear, it is clarity. Go ahead and write your score in the comments. I'd also like to know your age, where you're watching from, and which type of blood in the urine worries you most right now. Save your score, because we're coming back to it. Now let me give you 1 minute of simple science. Doctors use the word hematuria for blood in the urine, but even that single word contains different categories. Mayo Clinic says if you can see the blood, it is called gross hematuria. Blood that cannot be seen with the naked eye is called microscopic hematuria and is only found under a microscope when a lab tests the urine. Mayo also says that while bleeding often is not painful, passing blood clots can hurt, and blood in the urine can be a sign of serious illness even when the cause is harmless in many cases. NIDDK also divides hematuria into 2 main types: gross hematuria, when you can see blood in the urine, and microscopic hematuria, when you cannot see it but it is found under a microscope or on urinalysis. It says common causes can include infection or inflammation, stones, trauma, recent urinary procedures, BPH, vigorous exercise, and sexual activity, while more serious causes include bladder, kidney, or prostate cancer, blood clotting disorders, sickle cell disease, and kidney disease involving the glomeruli. Cleveland Clinic adds that blood in the urine should not be ignored, and that associated symptoms can include frequency, pain or burning, urgency, fever, chills, lower back pain, abdominal pain, and flank pain. It also notes that untreated hematuria can lead to bigger problems if the cause is serious. So the lesson is not that one type matters and another doesn't. The lesson is that doctors treat them differently because the risk, urgency, and meaning can be very different. So now let's count down the 3 types of blood in urine doctors treat differently and why it matters. We're going from number 3 to number 1, and number 1 is the type older men misunderstand the longest. Number 3 is this: microscopic blood in the urine is quieter but not always harmless. This is the type many men never know they had until a routine urine test picks it up. Nothing looked red, nothing looked pink, nothing felt dramatic. They felt normal. Then a provider says, "There's blood in your urine." That can be very confusing because microscopic blood feels less real to a patient. If you couldn't see it, it doesn't feel urgent. It doesn't feel important. It feels technical. It feels like something that only exists on paper. But that is not how doctors see it. Mayo Clinic says microscopic hematuria is blood that can't be seen with the naked eye and is only found under a microscope. NIDDK says the same, and Cleveland Clinic notes that many times people with this kind of finding have no symptoms at all. Here is how to think about this more clearly. Microscopic blood is often treated with more context and risk stratification. Doctors ask who you are, how old you are, whether you smoke, whether you have symptoms, whether it persists, and whether other risk factors make it more meaningful. It may not always trigger the same level of alarm as visible bleeding, but it is not automatically dismissed either. What should you notice? Not what you saw, because often you saw nothing. You should notice that the urine test found something your eyes could not. Why does this matter? Because older men often treat invisible blood like imaginary blood, and that can lead to false reassurance. The most common mistake is saying, if I couldn't see it, it can't matter much. If you need an easier version of this check, ask yourself one question this week. Was the result invisible, or was the warning just quieter? That question can reveal a lot. Number 2 is this. Visible blood in the urine is more obvious, and doctors usually take it more seriously from the start. This is what most men picture when they hear blood in the urine. Pink urine, red urine, rust-colored urine, cola-colored urine, a moment that gets your attention right away. And in one sense, that reaction makes sense. Visible blood is harder to ignore because it is visually dramatic. Mayo Clinic calls this gross hematuria. NIDDK calls it gross hematuria too. Visible blood often moves the workup faster because the signal is stronger. Mayo Clinic says visible blood in the urine can be a sign of serious disease, including bladder, kidney, or prostate cancer. Cleveland Clinic says blood in the urine is an important warning sign and should not be ignored, but here is where men still get fooled. The blood may come and go. It may happen once. It may not hurt. And because of that, many older men still talk themselves out of concern. The American Cancer Society has said that blood in the urine can be the first sign of bladder cancer and may go away and come back. And early bladder cancer often causes bleeding with little or no pain. That is exactly why visible blood cannot be judged only by whether it stayed or whether it hurt. What should you notice? The fact that visible blood changes the conversation immediately, even when you feel fine. Why does this matter? Because older men often wait for visible blood to repeat itself before deciding the first episode counted. The most common mistake is thinking, I'll take it seriously if it happens again. If you need an easier version, ask yourself this. Would I dismiss blood anywhere else in my body this easily? That is an important question. And before we move to number 1, if this video is helping you understand your body more clearly, take a moment to like the video and subscribe to American Urologist. It helps me reach more older men who may be getting confusing urinary symptoms and trying to make sense of them quietly. And if you've made it this far, let me know in the comments which type of blood in the urine seems hardest for men to understand. Now let's get to number 1. Number 1 is this. Blood with clots is not just more blood. Doctors often treat it as a different level of problem. This is the message older men miss the most. A lot of men think clots simply mean heavier bleeding. And yes, in one sense they do. But clots are not just a visual detail. They can change the physical situation inside the urinary tract. Mayo Clinic says the bleeding itself often is not painful, but if blood clots get passed in the urine, that can hurt. Search results and clinical references also make clear that clots can obstruct the flow of urine. That is why doctors often treat this category differently. Once clots appear, the question is not only what is causing the blood, the question is whether the bleeding is now creating blockage, pain, retention, or an urgent mechanical problem in the bladder or urinary tract. Here is how to think about it more clearly. Microscopic blood may be subtle, visible blood may be alarming, but clots can become functionally dangerous. A man may strain, he may pass painful clumps, he may feel like he cannot empty. He may stop focusing on the cause and start dealing with a bladder that simply is not draining well. Why does this matter? Because blood with clots can move the conversation toward urgency more quickly than the other two types. The most common mistake is treating clots like a cosmetic detail rather than a sign that the urinary system may be under more stress. If you need an easier version, remember this. Microscopic blood is quieter, visible blood is louder, but clots can make the situation physically more dangerous. Now let me give you 3 daily boosters that can help older men think more clearly about the 3 types of blood in the urine. First, learn the categories. Microscopic blood means you cannot see it. Gross hematuria means you can. Clotting means the bleeding may be acting differently and sometimes more urgently. Second, stop judging seriousness only by drama. Microscopic blood can matter even when it feels abstract, and visible blood can matter even when it is painless. Third, pay attention to what the bleeding is doing, not just how it looks. Is it a lab finding? A visual event? Or is it now affecting pain, flow, or the ability to urinate? Now let's close the loop. Think back to your starting score. If you scored low today, do not let that uncertainty disappear into the background. Recheck yourself in 2 weeks if you are already being monitored and your clinician has given you a plan. But if you have visible blood, recurring blood, or especially clots with difficulty urinating, do not treat those as interchangeable categories. Today, we talked about the 3 types of blood and urine doctors treat differently and why it matters. This is not about panic. It is about understanding that doctors do not treat all blood in the urine as the same story, and older men should not either. Your urinary health matters. Your bladder health matters. And the kind of blood in the urine you have can change the level of concern more than many men realize. If this video helped you, share it with another man over 60 who needs to hear it. And if you want to keep going, watch the next video on your screen, where I'll break down the bladder cancer warning signs older men mistake for a simple infection. I'm Dr. James Whitaker. Stay informed, stay steady, and I'll see you in the next one.